here. So good afternoon and welcome to the Health and Government Operations Committee. It is Friday, April 5th. Am I correct? April 5th. And we are voting, and we're going to be voting on some concurrences. We actually had a rules quick meeting to get some bills out. They're bills that belong to mostly senators, and they were bills that the House members from here had crossed. And they worked, worked on the bills very hard as well. So we're going to get their bills out just to vote on it. We're not going to have hearings on those bills because we already had those hearings and they're identical. So they're going to come tomorrow to us, and we'll probably get off the floor and vote them because we know them already. So just to let you know that you can, be on the lookout for an announcement for a voting session tomorrow. But we're not having any more hearings, not if I can help it. And I can. So we try really hard to do that as well. So we have some concurrences, and the LAs will explain them.
Senate Bill 245, this is the Maryland Community Health Resources Commission Sunset Extension and Program Evaluation. HGO extended the MCHRC for 10 years instead of 3. Finance did not concur with these amendments, and so the chair will say what you would like to do.
I would like to basically do the following on this, which is not receipt, and ask the Senate to reconsider. So may I get a motion, please? Thank you. So we're going to do that. And, the Finance Committee and us, we have been working beautifully together. The chair as well. We're in touch every week and have been keeping each other informed. So I'm going to respectfully ask this, and hopefully she'll reconsider. Can we move on the next one, please?
House Bill 576 is the Assisted Outpatient Treatment Program bill. The Senate has amended it, and it passed the Senate unanimously. So the Senate amendments strike the authorization of psychiatric nurse practitioners to evaluate an emergency evaluee for purposes of involuntary admission. They provide that the issuance of an AOT treatment order against a respondent may not be the basis for the involuntary admission of the respondent to a facility or used as evidence of incompetency of the respondent. The amendments add the same rights and protections for individuals under an AOT order that exist in current law for individuals under guardianship for disability. It requires a care coordination team to include certain members, and requires MDH to establish clinical and operational standards for AOT programs and care coordination teams. The amendments add reporting on system-wide impacts of implementing AOT and costs incurred by MDH or counties that implement AOT, and sunset the AOT program in 5 years.
Okay, so we're going, those amendments, Marie, would you like to please come up? And I'm sorry, I'm going to put you on the spot, but so that our committee knows that you're okay with these amendments, that they actually work well.
Yes, thank you, Madam Chair and committee members. These are all amendments that
I have your name and position just
Sure.
for the record.
Marie Grant, Assistant Secretary for Health Policy at the Maryland Department of Health. The administration and the Department of Health are comfortable with these amendments. They are amendments that we worked on closely with the Senate committee and leadership, and I think they were a big factor in a unanimous vote on the Senate floor yesterday and today. So,
and I just want to tell the committee that it's taken 22 years for this bill to pass. 22, okay? And it was a lot of work by many people. And I want to thank the Secretary of Health and Marie particularly for all the work you did. And there's a particular woman that I am in awe of her, and that's Evelyn Burton. And Evelyn, if you're watching us at home, you are an angel. And she met with almost every single senator in the Senate. That woman came every day to meet them in the hallway, in their office, wherever she could find them. And I want to say how you made a big difference. And this is a big deal. It's a big deal for those people, 500, 700 people that end up being you know, uh, arrested and end up not getting the treatment they need, and they end up on the street. Okay, and this will help those people, and they deserve a chance. And Evelyn, you did it. I also would like to thank Delegate Heather Bagnall and Delegate Tiffany Alston for your hard work, because you worked really hard on it. And lastly, Delegate Steve Johnson, it was his bill. His bill. And oftentimes I have encountered the years that I've been here, people that you'll say, the governor will like your bill, or we like to put the bill in the budget, and they fight you. They don't want to give up their bills. And I have a lot of respect for you, because it's not about getting the credit, it's about getting it done. And you can claim the victory because you were so humble and you gave it up. And I want to thank you, Steve, on behalf of all of us, okay? You guys, when you go home, you'll understand after you read the memo from the LAs, the work that this committee has done with the finance committee, because we are a partner, and because leadership allows us to lead this way, the speaker, which is wonderful here in this house as well. So I want to say thank you, Marie, on behalf of the committee, and Aaron Hopwood, for all the drafting and all the calls on this particular bill as well. And if I didn't thank someone else, and if I forgot, just all of you, it takes a team, it takes a village. Thank you for working on this bill. It's a big deal. It really is. I'm not going to even be humble about this one, because it is. Thank you, Marie.
Leadership and bringing folks together last year, and everyone that worked on this for all the years, but last year into this year, and really forging the basis for what we were able to do this year. Just thank you for taking this important issue on. We wouldn't be here without all of you and your leadership. So thank you.
Thank you, Delegate Johnson.
Thank you, Madam Chair. While you're at the mic, I wondered, what was the reasoning for the sunset? Could you let us know that?
So I think there was an amendment that was floated, not presented in voting, but floated for a 3-year sunset. The ultimate amendment that was offered by the chair in finance voting was 5 years, and that's 5 years from the effective date of the bill. So that's 2030. And I think it was just something to make folks more comfortable, that they would come back and take a look at how the program is doing. I know there's rigorous reporting in there. I'm not sure that we needed a sunset, but it was something that made the committee a lot more comfortable on the Senate.
You're welcome. So any other questions or concerns? Yes, Delegate Hutchinson.
Thank you, Madam Chair. Aaron, you mentioned one of those amendments said about reimbursement to the counties or something like that. Could you repeat that
No,
one?
it's just part of the report would be the cost effects to the counties.
Okay, thank you.
And remember that the counties that are not able to do it, the way the bill passed, they don't have to be part of it. They can just let the Department of Health know that they won't do it, and the Department of Health will come and do their own program. And that was a compromise for those counties that are smaller and do not have the resources, and that's still there. Any other questions or concerns? With that being said, are we going to move to concur? Second, all those in favor say aye. Any opposition? All right. Woo, 22 years. Thank you. All right. You have anything, Lisa? Go ahead.
So there is Senate Bill 595, which is Health Benefit Plans, Calculation of Cost Sharing, Contributions, Requirements, and Prohibitions. It's Senator Hershey's bill. We had amended it to look like the House bill and sent it back, and they did not accept our amendments and are asking us to recede from our position.
What are those?
It's basically, well, Delegate Collison. I'll let Delegate Collison do it.
In the House version of the bill, it was very specific around how the co-pay assurance would apply towards the deductible, and that the user of the copay would be notified with respect to the amount of the copay assistance and how long they were going to be able to use it. And that was a very simple part of the bill. In the Senate, had other language in there. They removed the notification piece. They maintained language that really spoke about the relationship between pharmacy benefit managers and insurance carriers, which didn't really, have any effect or impact on our bill, on the effect of the accumulator. So there's still work to be done on the bill, and I expect that we'll see it again. But I am not prepared to recede if that is the will of this body.
So I think, yes, Delegate, Shalega, go ahead.
Thank you. What does this mean for patients? So PBMs and, in the end, our objective was to ensure patients got the benefit of that coupon. Are they still going to get that benefit under the Hershey bill?
They would get it. Yes, they would get it, but it would be, but they would have the same situation which they have now in terms of not being able to predict how much copay assistance they were going to get and how long it was going to last and how, it would overall affect the cost of their medicine. So,
Which was the intent of
Right.
why the bill was
It's
put
the
in,
original intent.
introduced.
Let them apply that to their deductible.
That's
So they're
right.
still letting them apply it to their deductible or not anymore?
They are in the Hershey bill, but without any knowledge of or predictability around it. Yes, as
You get a coupon and it's $500 that you
Mhm.
put towards your deductible. And then you go in to refill your medication and you may or may not get that $500.
Correct.
Oh.
and there's no notice of that.
So if we don't agree with the Hershey bill, do patients end up with nothing?
No, they're gonna end up with exactly what they have right now, the
Right.
same uncertainty.
Right. They
And we
can,
were trying to fix that uncertainty. It's okay. Go ahead. Go ahead and finish.
Yeah, so right now they get the copay assistance, but they will be required to pay their copay as they are now. So for example, if you have if you have a co-insurance of like 20%, and the drug is $500 and they have reduced it to $400, then the patient will still pay the $80, the 20%. Whereas under the bill that we were trying to pass, that $400 would count towards their deductible and they wouldn't have to pay the copay. The only thing the Hershey bill did directly related to the accumulator was to allow the copay assistance to go towards the deductible. Right now, that's not the case.
So the bill, the way this body here voted on, it is a true consumer protection bill, especially for the senior citizens, to allow them to know exactly what they're getting, when they're getting it, which is what they were complaining about, right? Or had concerns about. That's a more positive word. So it defeats the purpose. Go ahead.
Thank you, Madam Chair. So where I was going at first and where Delegate Shalega was going, and it's what you just asked. If it sounds like we're receding, but if we weren't to, the Hershey bill as is really does nothing for the consumer. Is that accurate, or gives some information but doesn't necessarily give financial help?
It does give the financial help, but it doesn't count towards the but it's unpredictable.
Okay,
Right.
thank you.
I hope we can get them to see it our way.
We pray.
But if it dies because they won't agree, then patients again are left with nothing.
Yeah,
Is
but
what we're
we
saying.
need
So we
to-
still have 2 days to
Yeah,
get them to agree. Okay,
that's right.
I'm gonna be positive. Thank
Well,
you.
you know, can I say something? Senator Hershey and I have a good relationship. As you know, you see when he comes here, I asked him, may we meet? You know, and I met with him in my office and we try to explain it, right? So I have asked nicely, kindly, why this is important, because why not do it right from the beginning, right? And that is what we want to do. We get a chance, as you know, it's very tough to do these bills in this committee when you have pharma involved. And this is a great, I'm being honest as I can be. And this is a great compromise. So I'm going to say that our position is going to be, may I have the bill? I'm going to move not to receive and ask the Senate to reconsider. Is that okay? We have 2 days left, right? Okay, thank you. Thank you. Yes.
Thank you, Madam Chair. It is important because one of our amendments put us in line with federal compliance and the other one put us in line with the generic language in every program that we have in Maryland. So it is important that our version passes. So with that, I'm comfortable with the not concurrence.
Yeah,
Thank you, Madam Chair.
you're welcome. Delegate Hill.
Madam Chair, I appreciate it. I just want to be clear. Why is it they refuse to go to conference with us on it?
No, they haven't refused to go to.
Okay, so
That's not, I mean, they could have assigned a
Oh, that's
conference
right,
committee
that's right.
and they did not.
all right.
But I
so-
do not want to read into their intentions.
Got it. So
Okay.
I guess that's my, okay.
Yeah,
So they're holding that bill. And so we're asking them to reconsider.
yes.
Is there another step about requesting a conference?
No, for us, the rules, we can only. We can, but they already asked for us not to recede and for us to, you know, reconsider. And we're asking them to do the same. We have 2 days. Let's leave it that way.
Question was, if they come back, do we still have room to say, rather than back and forth, will you receive? No, we won't receive, because at least in a conference, we can explain why we feel the way we feel.
But we've
whereas-
done that already.
Okay.
We
But-
done it.
But with one, and you, I'm not trying, I know you guys have been working on this really
Yeah.
hard. I'm just trying to get clarity. Then as we're working the bills, usually, and I don't know in this case, the sponsor is who we're in discussion with. But usually, if I understand correctly, when we go to conference, there are 2 or 3 other people who get assigned, who may be more open because they haven't been presented with the entire picture. Not, okay, all right, I was hopeful.
Yeah. So it's
Senate Bill 595.
okay. So we have already explained why the bill is important the way it is. And we have tried. So let's try one more time. Is that okay? All right. Thank you. It is Friday. I'm hopeful. Tomorrow is Saturday. We have Monday till midnight, right? They are.
They will.
Yes. Yeah. So let's hope, let's hope, okay? I always want to try honey, and because it is a stronger bill and we'll see. Hopefully they'll do it. And if not, we'll figure it out, okay? I want to be respectful and allow it to work itself out, okay? Thank you. Anything else? Yes.
So Michelle, correct me if I'm wrong, it's House Bill 1122, which is Delegate Kerr's nursing home acquisition bill, and the amendments in the Senate change and to an or and make some clarifying changes.
All right. Delegate Kaiser.
The question everyone's thinking though, but like, is it an important and to or? Like what's, I mean, sometimes it's like fundamentally the whole bill.
She's absolutely right.
By all of the parties and there, it was, I'm not sure if it, I'm trying to remember, it was.
It's agreed to by all parties.
What I
Yeah.
heard was that it's not material and that it's not gonna change things majorly in any way. It's a clarifying may and or, okay?
Instead of.
All right, so we're going to go ahead and accept it. It's okay. We're going to accept it. Anything else from anyone else? What is it? We have a what?
Like I don't have.
Okay, it's okay. So that's it, right, for concurrences? All right, so just for planning purposes, we got out of rules about 7 or 8 bills. They're senators' bills that were crossed with some of you here. And they worked hard on their bills as well, and they deserve it. So I went ahead and, since they were meeting, I went ahead and got it out for them. And we're going to probably get off we're not having hearings because they're identical. We're going to take you probably off the floor or come back here quickly and just vote those bills. They're identical to what we passed, okay? And then tomorrow. And so those bills, files will be ready for you probably today. If they are ready for you today, please take them so you can look at them tonight and be ready. The people that will have those bills are the same people that had the original House bills. Michelle.
Have the bills yet as a committee.
Yes. Yeah, we don't have it. So what you will have is the floor report. All right? Maybe. I don't want to stress the LAs if they can get it done. Okay, wonderful. Any questions for him, anyone? Yes.
As you were so kindly mentioning all the Senate bills coming out of rules, I make sure that all the members know that I'm sure our Senate counterparts are doing the same with our House bills, and I'm sure you're taking care of that for us. And I just thought anyone who's wondering about their House bills that have gone over in the last few days that are identical cross files, they should be treated as well as you're treating their bills.
Yeah, and leadership is doing that. Yeah, we took care of that yesterday. And if you have something in rules, let us know, correct us. But my understanding is that it's the same thing. Okay, as well. Good point. Anyone else? All right, you can bring us down. Thank you.